Hello, friends. All right, so I wanted to talk with you guys. I just got this cool book. Have you ever tried to start eating a new health plan because you're like, hey, I need to get healthy? And what I hear a lot of people go to first, and this may be you, maybe me at some point, is you start eating a lot of salads because it's like, well, duh, I'm supposed to eat more vegetables. We all know that, right? Well, sometimes people will do that and they will start having bloating and they'll feel terrible. And even sometimes they'll have kidney stones and they're like, what the heck? I thought I was doing good and now I'm feeling bad. Uh, so, what may be happening is you may be experiencing the oxalates in some of these foods. You find them a lot in fresh greens, which salads tend to have a lot of. And so there's some ways and tricks that you can go around this. One thing I would say is start with, if you can, ideally, you meet with a provider who can dig into the root cause of what's going on with your body. Where are your gaps nutritionally? Where are your gaps in your lifestyle and can help kind of guide you? That's the best case scenario. If you don't have access to a guide, though, these are some things that I've seen work really well. Again, this doesn't replace medical advice. I'm a nurse practitioner, but I'm not your nurse practitioner. And you should always consult your own provider whenever you're making these kind of changes because it can have an impact, especially on medications. Different medications can interact with different foods different ways. So you want to be careful with that and be mindful, be educated. That's what we're here for. So, first things first, whenever you're eating these greens, they're really great for feeding the good gut bacteria. You may have heard that we have bacteria in our gut. You maybe haven't, but we do a whole heck of a lot of it. And it actually is important for how you digest food, it's important for how you make hormones. It really, the bacteria in your gut plays such a crucial role in so many things. So you really want to feed them well. So eating vegetables, duh, sounds like a great idea. It is a great idea. But if your diet has been mostly like most Americans, it's packaged foods and you're eating mostly, restaurant foods, but you're not really getting all that much raw, fresh vegetables, it can cause a problem when you first start. And especially, I've had people who, sometimes it's like, okay, that's all I'm eating. Like I'm going straight to salads every day, all day. I'm eating salads. And so, if you don't have enough of this good gut bacteria, it can't break down those oxalates in the vegetables. And so that's important. So making sure that you start with your gut, get some healthy, good probiotics. Um, lactobacillus is one that is excellent for breaking down oxalates. There's also one that it has oxalate in the name. And so you can look up different probiotics. You want to shoot for, it depends on some different variables, but if you've had antibiotics in the last year, you probably need a ton of new good gut bacteria put in because you killed it off with your antibiotics. So I've had patients who need even upwards of 200 billion of probiotics to restore what they lost. And they might need that for a whole couple of weeks and then we kind of back off. Most people need around 20 billion a day. Hopefully, you're getting that from some good food sources. But like I said, if you haven't really built that up, and it can take time, it can take like 6 months to build up good gut bacteria. So during that time, you want to focus on what you're putting in. So get the good guys in there, right? If you start putting good guys in there and you start having bloating, that could be a sign that the good guys are killing off the bad guys. There actually is like a gut war going on inside of you at all times where the good guys are fighting off the bad guys. And so you want to make sure that, it kind of push through. If you start having really terrible symptoms, it could actually be that you've got one type of bacteria that's overgrown. They call that small intestine bacterial overgrowth, or sometimes you can even have yeast or different things like that, that you don't want to necessarily be feeding that even more. You want to kind of get that lined out. This is where that provider really helps because you have somebody who can help figure out, okay, what's going on? What do I need to dig into? But usually people start a probiotic, they might have a little bit of bloating, but then a couple days in, they start feeling better. You'll know you're doing well because you should be having at least two good poops a day. As a nurse, I talk about poop all the time. Sometimes it makes people uncomfortable, but you should be. You should be pooping twice a day, and they should be good, fluffy poops. Every once in a while, they should, float, but most of the time they should sink. And you shouldn't have to wipe a whole bunch because if you do, you're not getting enough fiber. I know, gross things to talk about, but anyways, I want you to know what to look for when you go to the bathroom. You see your own stuff every day. This is a good way that you can tell whether or not you're doing well with your diet. The next thing is you want to make sure that you add in those new vegetables kind of slow because some things might affect your system differently. Uh, Going back to if you're on medications, but knowing what kind of bacteria is in your gut, you may not know. And you may not know what you have to break down these different things. So start slow. I usually recommend if you haven't been eating any vegetables, start with just one serving of vegetables a day. Okay. And try to get it, from an organic source if you can. And then add another one, wait a couple of days, see how you feel, add another one. And then as you're adding in the good foods, people always ask me, I treat a lot of people who are trying to lose weight or, lose body fat and really focusing on getting in those key nutrients first is really important because it's hard for you to make the hormones you need to regulate your appetite and do so many other things if you don't have the micronutrients, which is like vitamin A, vitamin D, vitamin B, all of those things in minerals. You need minerals in order to do all the metabolism of the rest of the food. So you want to make sure you're getting in good food. I'm a really big fan of grass-fed beef, also lamb. Getting in good lean protein sources from healthy farmers. Know your farmer if you can. It's great. And then getting plenty of hydration. Start there, and then add in movement. Make sure you're doing something a day, every day. Um, don't overdo it. I wear Whoop, which can help you track whether or not you're overdoing it because there's a strain number that calculates every day and it factors in your recovery, how well you slept, so many other things. Stress, it's just an amazing tool for you to be able to see how hard am I pushing myself. As a business owner, I often can not really pay attention to how hard I'm going, and you are like that as well. I'm sure you're busy taking care of kids or you're busy doing things in your life, and you can push yourself harder than you think you are. So be sure that you're not overdoing it, but you want to be, getting movement every day. I shoot for at least a 10 strain every day. And that way I know that I've, gotten a good amount of movement, at least 30 minutes of consistent movement every day. And I really try to get out in the sun, those kinds of things. Those are the things you want to make sure you're adding into your life first. So start with that. And like I said, if you start noticing, hey, I started eating all these salads and I'm having issues, don't get discouraged. Build up that good gut bacteria and then add it in slowly. Your body will start building up more and more of the bacteria it needs to help you digest it. And so just because you can't eat it all today and if you have problems with the day today doesn't mean you always will. I hope that encourages you. I hope you guys got something out of that and have a great day.